Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been coming to grips with a lot of my health issues over the years, but it seems like as soon as I get one thing under control, another pops up. My diabetes is under good control right now, thanks to the metformin and really watching my diet. My last hemoglobin A1C showed excellent control, which I'm proud of, but I'm a bit worried about the effects on my kidneys over the long term, especially with my other conditions.
I see you've been doing a great job managing your diabetes. Your proactive approach is definitely helping. Let's keep monitoring that closely, especially how it interacts with your other conditions. How have you been feeling lately in terms of your energy and your daily activities?
Well, my energy levels have been pretty low, and I struggle with the neuropathy in my hands and feet. It makes it hard to be active as much as I'd like. The pain and stiffness in my feet and ankles are quite bad, and it doesn't help with my COPD. I've been trying to cut down on smoking, and I'm now down to 1 pack a day. I've set a quit date for January 26. I'm really hoping that will help with my breathing.
Reducing smoking will definitely benefit your lung function and overall health. It's good to hear you have a quit date set. We'll support you through that process with resources like nicotine patches. Tell me more about how your COPD and emphysema have been affecting you.
It's been tough. I feel short of breath more often, especially with any kind of physical activity. My pulmonary function test showed I've got about 60% lung function remaining. It's scary, but I'm trying to stay optimistic and follow through with the plans to quit smoking. Also, my back and between my shoulder blades have been really sore. I don't know if it's related to my lung issues or something else.
Back pain can indeed be frustrating, and it might be compounded by your lung condition due to coughing, or even in the way lung issues can alter your posture and the way you move. It's something we should keep an eye on, especially to differentiate if it's musculoskeletal or possibly related to something else.
And with the neuropathy, I just feel like my mobility is getting worse. The pain and the lack of sensation in my feet make me worried about falling. I've read that this can happen with diabetes, so I try to be careful.
It's very good that you're cautious. Managing your neuropathy effectively is key to preventing complications like falls. How about your mental health? You mentioned using strategies to manage your bipolar disorder.
I've been stable on my medications, valproate and risperidone. I make it a point to slow down and spend time with my family when I feel overwhelmed. It helps me manage stress, which I know can affect both my mental and physical health.
It sounds like you're using some great strategies to maintain your mental health. Keeping stress levels manageable is important, especially with your physical health concerns. Now let's go over your recent clinical values to give you a clearer picture of where things stand and discuss our next steps.
Please go ahead.
Your recent weight is stable at 167 pounds, which is good considering your history of fluctuating weights. Your blood pressure readings are a bit high, which we need to keep in mind given your overall health picture. The good news is your fasting glucose levels are averaging 98 milligrams per liter, which is excellent for diabetes control. Your cholesterol levels are also in a good range, which helps reduce the risk of cardiovascular issues. However, your liver enzymes, AST and ALT, are slightly elevated, which we'll need to monitor. Your renal function is slightly diminished with a creatinine level at 1.2 milligrams per deciliter and an eGFR of 55 millihistamine and 1.73 millisquatters, which is expected considering your long-term diabetes. In terms of your COPD, the chest X-ray confirmed emphysema with no acute issues at the moment. We also noted the benign cyst in your pancreas remains stable with no signs of change, which is reassuring. Your PSA level is slightly elevated at 4.5 nanograms per milliliters, so we'll keep monitoring that in context with your other prostate symptoms. As for the plan, we will continue your current medications and focus on smoking cessation. I'll schedule follow-ups for your hemoglobin A1C and kidney function tests. It's important we keep monitoring these closely, given your history and recent changes. We'll also continue to keep an eye on your liver function and overall pain management.
Thank you, doctor. I appreciate your thoroughness. It helps to know exactly where things stand.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having these chest pains for a while now, and they've been coming and going. The worst one was a few months back. It felt like a 6 out of 10. I ended up in the hospital for that. They did some tests and noticed some blockages, but things have been a bit better since then. Still, the chest pain pops up now and then, but it's more like a 3 or 4 out of 10.
I see. Can you describe these chest pains a bit more? Like, where exactly do you feel them? And do they spread anywhere else? What seems to trigger them?
It's mostly in the center of my chest. Sometimes it feels a bit like pressure. Other times it's more of a sharp pain. It doesn't really spread to other areas, just stays in the chest. I've noticed that sometimes after eating certain foods or when I'm stressed, the pain comes back.
You mentioned hospital visits and tests. Can you tell me more about your history with heart issues and any other significant medical procedures you've undergone?
Well, I've had a couple of heart attacks before. One just recently in April, and a couple way back in 1998 and 1999. Each time they found blockages and put in stents. This last time, they even placed new stents over the old ones. Apart from that, I have a history of deep vein thrombosis in both legs since 1998, which has been quite a challenge. I also had a craniotomy with a patch inserted and some surgery on my left leg for drainage and swelling issues.
That's quite a medical journey you've had. How about your medications? Are you managing to take them as prescribed?
Yes, I take a bunch of medications like aspirin, warfarin. I've been adjusting that one after INR tests. Metoprolol, simvastatin, Coumadin, some diuretics, and they've just told me to start on Plavix right away until I see a cardiologist.
Good. It's important to keep up with those, especially with your complex history. Have you noticed any side effects or issues with the medications?
Not particularly, doctor. I manage them okay, but it's a lot to keep track of, especially with the warfarin and keeping my INR levels stable. It's a bit of a balancing act.
Understood. Let's talk about your recent stress test. What did the doctors say about the blockages compared to before?
They said there are blockages, but not as severe as they've seen in the past. So that's a bit of relief, I guess. But they're still concerned enough to suggest a possible catheterization.
That makes sense given your history. How about your daily life? How are these conditions affecting you?
The leg swelling has been persistent, but the medications help a bit. It's the chest pains that worry me. They make me anxious about having another heart attack. I try to stay calm and avoid stress, but you know how life is.
Absolutely. Managing stress is key, especially with coronary artery disease. Do you have any upcoming appointments or plans for further tests?
Yes, they've set up an appointment with a cardiologist next week, and they mentioned the catheterization. I'm hoping that will give us a clearer picture of what's going on and how we can tackle it moving forward.
That sounds like a solid plan. I'll summarize everything now. Based on your history and symptoms, the immediate plan is to ensure you start on Plavix and continue monitoring your chest pain closely. An urgent referral to cardiology is already in place, and we need to keep a close eye on your symptoms. If there's any increase in frequency or severity of your chest pain, you should seek emergency care immediately. We'll follow up with the cardiologist for a detailed assessment and management plan. It's crucial to stick to your medication regimen and keep all your appointments. Let's make sure to tackle this proactively.
Thanks, doctor. I'm relieved to have a plan and appreciate your help in coordinating all of this. I'll make sure to follow everything to the letter.
You're welcome. It's important to stay proactive about your health, especially with such a complex history. We'll do everything we can to manage this effectively.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
The major hurdle we face is the integration of multiple health services. For instance, how do we ensure seamless communication between primary care providers and specialists?
Absolutely. And beyond that, addressing socioeconomic barriers is crucial. Many of our patients lack access to reliable transportation or live in food deserts, which severely limits their ability to follow medical advice.
Right. And let's not forget about technology. While digital health can offer solutions, not all patients have access to the necessary tools or are comfortable using them.
That's a valid point. Perhaps part of our strategy should involve community outreach and education, making sure we meet patients where they are, both literally and figuratively.
I agree. Additionally, ensuring that our staff are trained to handle these diverse challenges is key. We need effective communication skills across all levels of staff, not just among doctors, but also nurses and support staff.
Let's also consider how we can utilize data more effectively to predict and mitigate potential health crises, which would allow us to act before the patient's condition worsens significantly.
Now look at question 26.
I understand that this is a lot to take in, and it's perfectly normal to feel overwhelmed. Let's take things one step at a time. What concerns you the most right now?
I'm just scared. What if the treatment doesn't work? I have my family to think about.
Those are valid fears, and it's okay to express them. Let's discuss what we know about your treatment options and how we can address these concerns together.
It's just all so much. How do I know what the right decision is?
We'll go through everything step by step. I'll provide you with all the information you need, and we'll make decisions together. You're not alone in this.
Thank you. That does help. I guess knowing there's a plan and support changes things.
Now look at question 27.
Let's focus on improving our patient education materials. We need them to be more accessible and easier to understand.
Agreed. Perhaps we should consider translating the materials into multiple languages and include visual aids for those with limited literacy skills.
That's a great idea. We should also train our staff to communicate effectively, ensuring they can explain complex health concepts in simple terms.
And let's not overlook the importance of follow-up. We need a system to check if patients truly understand their treatment plans and medications.
Exactly. And maybe using technology like apps or online portals could help patients access information easily and maintain engagement with their healthcare plan.
I think that's an excellent idea. Let's draft a proposal for these initiatives and discuss potential funding and resources.
Now look at question 28.
One of the biggest challenges is definitely resource allocation. How do we prioritize who gets what when our resources are limited?
It's a tough call. Maybe we need to improve our assessment tools to better determine the urgency and need of each case.
True. And we also need to consider partnerships with local organizations that can provide additional support.
Partnerships could indeed be beneficial. It could help us extend our reach and provide a more holistic support system for our patients.
Additionally, we should explore more about government and private funding opportunities to expand our resources.
Absolutely, and continuously training our staff to be adaptive and efficient with resource management is crucial. This way, they can provide effective support even when resources are stretched thin.
Now look at question 29.
Managing multiple health conditions can be challenging, but with the right approach, we can keep things under control. Let's start by going over your medications to ensure there are no conflicts.
I've been so confused about all these different pills. How do I know I'm taking them right?
That's exactly why we're reviewing this together. We'll go over each medication, its purpose, and how it interacts with others. We're here to clear up any confusion and make sure you feel confident in your treatment plan.
I appreciate it. Sometimes I feel overwhelmed keeping track of everything.
Understandable. We'll create a schedule that simplifies when and how you take each medication. Additionally, we'll discuss any potential side effects and what to do if you experience them.
Now look at question 30.
Today, I will outline the surgical plan we've developed for your condition. We believe this approach offers the best outcomes with the least risk.
Can you explain what the procedure involves and what I can expect during recovery?
Certainly. The procedure will involve a keyhole surgery. During recovery, you'll be closely monitored and will manage any pain or discomfort. Our team will support you every step of the way, ensuring a smooth recovery.
That sounds reassuring. How long is the recovery period typically?
Recovery time varies by individual, but generally, you can expect to spend a few days in the hospital, followed by a few weeks of at-home recovery. During this time, we'll have regular check-ins and provide any necessary support.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome everyone. Today, we delve into the complexities of managing sarcoidosis, an inflammatory disease that remains a challenge in the medical community due to its unpredictable manifestations and impact on various organ systems. To discuss this, I'm joined by Dr. Elaine Carter, an expert in pulmonary medicine with extensive experience in sarcoidosis.
Thank you for having me. Sarcoidosis is indeed a fascinating condition, primarily because it can affect almost any organ system, although it most commonly impacts the lungs. This systemic nature makes diagnosis and management particularly challenging.
Exactly, Dr. Carter. Let's begin by discussing a case that highlights the typical complexities we encounter. We recently managed a 45-year-old African-American woman who presented with persistent dry cough and shortness of breath. Initial imaging showed bilateral hilar lymphadenopathy, which is quite suggestive of sarcoidosis.
That's a classic presentation. But as we know, sarcoidosis is a diagnosis of exclusion. It's crucial to rule out other causes of lymphadenopathy and granulomas, such as infections like tuberculosis and fungal infections, or malignancies such as lymphoma.
Indeed. In her case, further investigations included a biopsy through endobronchial ultrasound-guided transbronchial needle aspiration, which confirmed non-caseating granulomas. With no evidence of infection or malignancy from additional tests, we diagnosed her with sarcoidosis.
Once diagnosed, the next step involves assessing the extent and severity of organ involvement. This particular patient had signs of lung involvement, but also complained of occasional palpitations and lightheadedness, raising concerns about cardiac sarcoidosis, which can be life-threatening.
Cardiac involvement necessitates careful screening. We conducted an ECG, which was normal, but given her symptoms, we proceeded with a cardiac MRI. This revealed late gadolinium enhancement, indicative of myocardial inflammation, confirming cardiac involvement.
Managing sarcoidosis with cardiac involvement is complex. Although corticosteroids are the mainstay of treatment for inflammation in sarcoidosis, they can have significant side effects. In her case, given the potential severity of cardiac involvement, we opted to start her on corticosteroids combined with methotrexate as a steroid-sparing agent.
Dr. Carter, could you elaborate on how you monitor such patients, considering the chronic nature of sarcoidosis?
Certainly. Regular follow-up is crucial. This includes clinical assessment, lung function tests, and repeat imaging. For those with cardiac involvement, periodic cardiac MRI or PET scans are recommended to monitor disease activity and response to therapy. Furthermore, assessing for potential steroid-related side effects is vital, requiring regular bone density scans, eye exams, and diabetes screening.
An interdisciplinary approach is also vital, isn't it?
Absolutely. Managing sarcoidosis often requires a team that includes not only pulmonologists but also cardiologists, rheumatologists, and occasionally neurologists, depending on the organ systems involved. This ensures comprehensive care and helps in addressing the multisystemic nature of the disease.
This case exemplifies the need for a personalized approach, given the variability in the presentation and course of sarcoidosis. Could you share insights on emerging therapies or research directions that might influence future management strategies?
Research in sarcoidosis is dynamic, focusing on better understanding the genetic and environmental triggers of the disease. New biologic therapies targeting specific immune pathways are under investigation, which may provide more targeted and effective treatments with fewer side effects than current therapies. Moreover, there's a growing emphasis on identifying biomarkers that can predict disease course and response to treatment.
That sounds promising. The development of more specific therapies could significantly improve quality of life for patients with sarcoidosis.
Indeed, and as we continue to learn more about the disease, it's crucial for ongoing patient education and support. Patients should be well informed about the nature of their disease, potential complications, and the importance of regular monitoring and treatment adjustments.
Thank you, Dr. Carter, for these invaluable insights. It's clear that while sarcoidosis remains a complex and often perplexing condition, advances in research and a thoughtful, patient-centered approach to care can lead to better outcomes.
Thank you. It was a pleasure discussing these important aspects of sarcoidosis management. Ensuring that patients receive the best possible care requires constant learning and collaboration among healthcare professionals.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello everyone. Thank you for joining today's discussion on an increasingly important aspect of pediatric health, sleep-related infant deaths. Our focus today centers on understanding the complexities of infant sleep environments, specifically in light of the recent updates to the American Academy of Pediatrics guidelines. We'll start with a case study that highlights the real-world implications of these guidelines. Let's discuss the case of baby Emma, a 6-month-old infant. Emma, a previously healthy baby, was found in a distressed state by her parents during a nap. The cause was linked to her sleeping in an incline sleep product, a choice her parents believed would offer comfort. Unfortunately, this product did not align with the safety standards recommended by the Consumer Product Safety Commission. The incline of the sleeper posed a significant risk, highlighting a critical point about the importance of proper sleep setup. The American Academy of Pediatrics recommends that infants sleep on firm, flat surfaces with no incline. This guideline is rooted in evidence that suggests non-inclined, firm surfaces significantly decrease the risk of sleep-related deaths. Inclined sleepers can increase suffocation risk by causing the infant's head to tilt forward, potentially obstructing the airway. This is especially dangerous for younger infants like Emma, who lack full control of their neck muscles. Furthermore, the semi-upright position can lead to positional asphyxiation, where the body's position prevents adequate breathing. Regarding the sleep environment, the AAP advises against the use of soft bedding, including pillows, quilts, and bumper pads in the infant's sleep area. These items pose a risk of accidental suffocation if an infant's face becomes covered during sleep. Emma's case serves as a stark reminder of the dangers posed by deviating from these established safety practices. Despite parents' best intentions to ensure comfort, the safety risks are considerable. The role of baby monitors in preventing sudden infant death syndrome, SIDS, or other sleep-related issues also warrants discussion. While such monitors can offer reassurance, they must not replace the essential physical and environmental safety measures. Scholarly articles emphasize that technological reliance should not overshadow fundamental safe sleep practices. The incident with Emma also brings to light the necessity for healthcare professionals to provide clear, actionable information to parents about safe sleep products and practices. Many parents are unaware of the potential risks associated with certain marketed baby products. Effective communication strategies are crucial for enhancing parental awareness and adherence to guidelines. We must consider the socioeconomic factors that influence sleep-related infant deaths. Access to safe sleep environments can vary significantly based on socioeconomic status. Addressing these disparities is essential for reducing the overall risk of such tragedies. Today's discussion not only raises awareness about the critical components of a safe infant sleep environment, but also underscores the ongoing research and policy efforts aimed at reducing sleep-related infant deaths. By integrating the lessons from cases like Emma's with current research, we can better guide parents, caregivers, and healthcare professionals in ensuring the safety and well-being of our youngest and most vulnerable populations.